Hello and welcome to today's Hangout with Dr. Douglas Dedo of the Ear, Nose, and Throat Associates of South Florida. Today, Dr. Dedo is going to discuss a type of sinus surgery called balloon sinuplasty. I'd like to now welcome Dr. Dedo to the Hangout. Dr. Dedo, how are you doing today?
I'm doing well, Chris. Thanks for having me on your show today to talk about this exciting new treatment for sinus disease.
All right, great. So, Dr. Dedo, what is balloon sinuplasty?
It is a revolutionary, new, safe, patient-friendly technique where we take a tiny fiber, introduce it into the natural opening of the sinus, and then over that fiber we thread a balloon, and when we inflate the balloon, it fractures the bone out, thereby keeping the opening of the sinus open permanently so it doesn't close back down, thus allowing the sinus to drain so that the mucus and infection can get out of the sinus. Because frequently what we're finding is that patients who have chronic sinusitis, headache, pressure, allergies, discolored mucus, be it green, bloody, yellow, constant drainage, altered taste, altered sense of smell, resistant to one antibiotic after another antibiotic, or they take an antibiotic, they get better, then they have to take another one, and they get better, and it keeps coming back. And the reason is that the sinuses, which are cavities in the face, are unable to drain properly. So the mucus that the lining of the sinus secretes 24 hours a day is a perfect culture medium for bacteria. So you've got a cheek sinus, it's filled with fluid. Bacteria get in there through the nose, through the bloodstream. They go into the sinus and they say, hey, this is a great place to hang out. We got everything we need, warmth, food, nutrition, nice, warm, wet environment. Boom, you get an infection. You take an antibiotic, the antibiotic via the bloodstream gets in and kills the bacteria in the sinus mucus, but doesn't get the mucus out. And it just sits there, and it's a time bomb waiting to happen. So with this new revolutionary safe procedure, we're able to, in the office, under local, almost painlessly, put a fiber up in the nose, get it into the sinus, open the sinus, and get it to drain.
Oh, great. So, Dr. Dedo, do you have maybe like a visual aid, or could you show us what the implement looks like that you would be using?
Sure. Let me take my little camera around here and see if I can bring into the camera the device. We see here the device, and it has a very fine fiber on the end of it. And what I'm going to do is I'm going to turn the light on so that you can see this fiber, and we can direct this fiber in any direction up into the nose. And then once the fiber is in the nose and in the sinus where we want it, we thread over the fiber a balloon.
Hmm.
And I hope you can appreciate this is the balloon right here that we inflate up to 10 atmospheres of pressure. And it's what they call a low volume, high pressure balloon, in that it's a very tiny volume, but it's a very, very high pressure. And we need that much pressure to take these little nasal bones, if you will, around the sinus opening and move them outward to allow drainage. So it's a very safe procedure because this fiber right here, this little lighted fiber, it is impossible to perforate an egg yolk. If we had an egg yolk here, you could not push this fiber into the egg yolk. It would just splay off, and it's very safe. So what I'd like to do is show you on a real human skull how we do this procedure, okay?
All right, that'd be great.
So let me get the camera down here. Here is a human skull, And this is the instrument here. So in surgery, we put this instrument into the nose, and then we thread the fiber up into the sinus. And we know where we want to be when we see the light in the sinus. See it right there, how it's all lit up? Yep. Now, you want to make sure I'm there? This is interesting. We can take this sinus, open it up, and this is looking into the sinus with the light in the bottom of the sinus, so we know precisely where we are. Once that's there, then we thread up the balloon into the sinus. With the balloon up in the sinus like this, we then inflate the balloon. And this allows us to open up that sinus opening. Can you see the balloon right here? And it's
yes, I can.
Up. Okay? So then we take the balloon down. We pull the fiber back out. We take the balloon back out. And presto, the sinus has been permanently opened in a very safe manner. And what we do is we do the both frontal sinuses here. We do the both cheek sinuses that are underneath the eyes. And we do the one sinus back in the back of the skull called the sphenoid sinus. And the amazing thing, Chris, is that I've been doing this for probably about 2 years. Prior to that time, I was doing 1 to 4 of the old-fashioned radical sinus surgeries where you go in and you basically grind out the sinuses, and it's about a 3-hour operation. It's a 6 to 8 week recovery time, and it is a relatively involved surgery that's done under general anesthesia. The beauty of this is done under local, in the office, takes an hour and a half max. Usually within 24 hours the patient's back to work. Maybe 2 or 3 days later they have a little drainage, and they go back to work in 2 or 3 days. Since I've been doing this procedure, I have not done any classic sinus surgeries. In fact, I've done about a half a dozen patients that had the radical sinus surgery, but because we didn't open up the natural opening of the sinus never really got to drain properly. We've made other openings into the sinus, but not the normal track that allows the sinus to drain naturally. So I've gone back on these patients, done balloon sinuplasty, got it up into the frontal sinus, opened up the opening, cured the sinus disease.
Wow, so let me get this straight. It's not only is it faster, it's less painful, and it's more effective. Sounds like a no-brainer to me.
What's even better is that it's covered by most insurance companies. Medicare, Humana, United, Blue Cross Blue Shield, Cigna, all the insurance companies cover this procedure. So the patient, it's a win-win for the patient.
Yeah, that's awesome. Well, I mean, on that note, Dr. Dedo, if the viewers out there want to get in contact with you or are interested in having this procedure done, what would be the best way for them to get in contact with you?
Have them call area code 561-693-6735. Area code 561-693-6735.
All right. Well, Dr. Dedo, thank you so much for taking the time out of your busy schedule and giving us a better idea of what exactly balloon sinuplasty is for and kind of who's eligible for it and who would need it. We truly appreciate it. And everybody out there, if you're looking to have this procedure done, I recommend you give Dr. Dedo a call. The presentation that you gave was amazing. And thank you again for joining us today, Dr. Dedo.
Well, thank you for asking me to be on your program, Chris. It is so much fun to find a procedure that is safe, effective, and works. It's revolutionized the cure of sinus disease.
That is amazing. That is truly amazing. Okay, everybody. Again, this was a hangout with Dr. Douglas Dedo of the Ear, Nose, and Throat Associates of South Florida. He was explaining to you what balloon sinuplasty is. If you want the procedure done, I recommend you give him a call. And everybody out there, have a great day and have a great week. Take care.